What's up, everybody? We are talking everything you need to know when it comes to the mouth. This is periodontist Dr. Leena Paloma, and I'm gonna bet she's never seen teeth like these. I mean, come on now, right? Dr. Paloma is a periodontist based in New York City and is a professor and chair of NYU's Ashman Department of Periodontology. Okay, we got a chair in the house. Bam! Yes! So what's the difference between a periodontist and a dentist? Give us the tea, doctor.
So a periodontist is a special kind of a dentist. To become a dentist, you go to school for 4 years. But it takes an additional 3 years of school after dental school to specialize in periodontics. A periodontist looks at not just the teeth, but the supporting structures of the teeth. So that means the bony socket that holds the tooth in place, the ligament that connects the tooth to the bony socket, and the gums and soft tissue that house all of those structures.
As a periodontist, you work hand in hand with dentists, or is that totally separate?
In regular oral care, one would see their dentist. A dentist would realize that there is a problem beyond general dental care and then refer to a periodontist. Alternatively, another healthcare provider, like an endocrinologist for somebody with diabetes, or a gynecologist, somebody who's going through pregnancy changes, might also refer a patient directly to a periodontist without going through a dentist.
So how can being pregnant affect your oral health?
When we have an influx of different hormones, you start to see changes in the gums. And those changes also can be seen in the ligament. The same way as the same hormones make our uteruses stretch, they make everything else change as well. It's important to tell your dentist if you're pregnant or planning to become pregnant.
Okay, internet, give us your best shot. This question is about a canker sore. Take a look at this video. It's gotten about 1.5 million views. What exactly is a canker sore?
Officially, it's called an aphthous ulcer. An aphthous ulcer is a little area in the mouth. It can be in the lining of the cheek. It can be around or under the tongue. It can be on your gums. And boy, is it annoying. It feels like it's your whole galaxy. You're like,
yeah.
And it's something that you just have your mind on until it goes away, which usually takes 10 days to 2 weeks. If it doesn't, it could be something more serious. And so if you have a sore like that that's persisting longer, any lumps, bumps, bleedy areas, ulcerations, more than 10 days to 2 weeks, call your dentist immediately. Report it, be vigilant.
So now in terms of treating a canker sore, I've seen a lot of videos out there on social media like this one, where he's actually putting salt directly on the canker sore. I mean, that's literally putting salt on a wound, right? Right?
That cannot feel good.
So do you recommend doing anything like that?
Treatment for canker sores is mostly symptomatic. And putting salt directly on a wound is not going to make you feel any better. So a little salt mixed in with water to reach that physiologic saline, that can help. Staying away from anything that has a drying effect in the mouth, anything with alcohol, anything that burns, anything too spicy, too hot, too cold. Over-the-counter numbing gels are available. I would stress selecting one that doesn't have sugar in the ingredients because we don't want to cause unnecessary decay to the adjacent teeth. We like to stay away from things like peroxide. We like to stay away from things like mouthwash that has alcohol when we're having an aphthous ulcer. And we like to look for triggers, the things that bring on these aphthous ulcers. Once you kind of know what triggers aphthous, you can avoid certain things. Sometimes it's tomatoes or orange juice. Everybody has a little different trigger, so prevention is the key.
How prevalent is gum disease? And how can life health challenges affect your gum health?
Well, gum disease is very prevalent. The starting component of gum disease, which is gingivitis, it's pretty universal. But if it gets beyond gingivitis and it starts to affect the bony socket that holds your teeth in place, now it's called periodontitis. And some recent reports have shown adults in America, just around half of us have it. So it's pretty prevalent.
So another thing that I heard is that if you have diabetes, that can also affect your oral health.
So diabetes increases your risk of gum disease, and gum disease increases your risk of poor diabetic outcomes. People don't think about it too frequently, but the teeth and the jaws, the supporting structures, are reliant on blood flow from tiny little capillaries. And so when those get clogged up in a diabetic patient, all those good healing factors from our blood supply don't reach the target. We tend to think of oral health as disconnected from our overall health, whether it's menopause, whether it's getting on a hormone replacement therapy for menopause, or even an oral contraceptive. All of those things regulate hormonal changes in the rest of your body and therefore also affect your oral health. But it's important to share that with your dentist because it's very similar and it's very much connected.
I know that all too well because I'm actually on a blood thinner and I had to have a procedure and my dentist was like, "What? You didn't tell us?" She's like, "Yeah, we got to check with your hematologist, oncologist." And I said, "Okay." So now I get it. Now I understand. It's all connected. People on TikTok have been posting videos about this dental condition known as dry socket. Take a look at this video, which got over 4 million views. What is dry socket and how do I not get one? Because that sounds like something I don't want.
Technically, a dry socket is known as alveolar osteitis. And when a permanent tooth is removed, whether it's a wisdom tooth or another tooth, normal healing is, again, through that blood supply. All the good healing factors from our blood come into that little socket and they form a blood clot. It's like a big piece of gauze. All those good factors come and get stuck in the gauze out of the blood. And that's how we heal. In the case of a dry socket, that fibrin clot gets somehow dislodged. Any suction in the mouth can dislodge that clot right out of that socket. And once that happens, there's nowhere for the blood and its good healing factors to come and lodge in the site that needs to heal.
What does someone do if that happens?
Dry socket happens. It happens sometimes without even doing anything to trigger it. Sometimes that clot gets lost and there's really no way to prevent it in some cases. But when it happens, you'll go back to the dentist. They'll give you something to flush the area so that you don't get any additional bad bacteria, any fungus, anything else in the site, any food debris. The other thing is symptomatic relief. So there's medications, mostly over-the-counter NSAIDs, sometimes back and forth with aspirin to keep that pain at bay.
Take that, dry socket. Comment below with your pressing health questions. And of course, hit subscribe here to the Health Channel to get more answers from medical experts on the questions you want to know. Dr. Paloma, thank you so much for joining us. Remember to see your periodontist for any medical advice. All right, now, so like I was saying, I have this hole back here. So